Hi, I'm Jared Payne. I'm a board member for the Brain Injury Alliance of Northern Kentucky. I'm here with one of my fellow board members, Deanna, at Gateway, and we're going to kind of tour and talk a little with her about Gateway and what all they offer. So, thank you for doing this.
Thank you.
First, we want to introduce yourself to the audience.
So, my name's Deanna. I'm a nurse by background. I've been a nurse for 27 years. And I, after doing rehab for a while, tested and became a certified rehab registered nurse. So, specialty in rehab. And just a few years ago, transitioned into the marketing side. So now I go out and educate and tell people what we do here because we're a little different than rehab in nursing homes and a different setting. So I want to make sure people get the right level of care.
And spoiler here, I did my rehab here, my inpatient rehab, and I loved it. So I'm a little partial to them. So
You
tell
did a great
us,
job.
thank you. Tell us about what all services you offer.
So we have both inpatient and outpatient services. Inpatient usually is right after the initial injuries, and that's when they still need, when brain injury patients still need some medical supervision. Sometimes blood pressure issues, sometimes infections that they're fighting, and they need the doctor to closely monitor the medical part and drive the rehab. Specifically the way they need to do it as they recover. The other is outpatient, and usually when they're a little more stable and they are able to live at home or sometimes in assisted or group areas, they come back here to do outpatient to refine things and finish it out. Like, you don't really need to be an inpatient, but hey, I still need to work on my grass, where I still need to work on a certain thing. So they can come in and do that.
Okay. So as far as brain injuries go specifically, anything else you want to add about the process there for newer or older injuries?
Yes, thank you for saying that. So sometimes patients come back into the hospital for something not even related to their brain injury. So if someone that had a brain injury in the past, maybe they get pneumonia or they get something like that, they go back into the hospital and they have a harder time recovering than somebody that never had a brain injury before. So they usually come back to do some kind, even if they have an old brain injury, they may come back and kind of tune up some of the areas that maybe declined while they were ill. And not always inpatient. Sometimes they just need that tune-up, I'll call it, as an outpatient. So it could be an old injury, and now this is becoming a problem as they got older or because of an illness or something like that.
Okay, great. So I know this is not typical, but can you tell me about a big brain injury recovery story?
Yes.
Okay.
And without using a name or anything specific, this one sticks out in my mind because they were a younger person. And you guys are all special because the progress that's made is amazing. The resilience and the speed of the recovery is usually is a much faster pace. So I saw this patient personally at an LTAC. So they had a really long hospital stay. Then they had to go to a long-term acute care, which is another level of care. And they were there for a long time. They were not able to really communicate. They were not able to transfer in bed. And it was a dilemma about whether they could do this program and participate. So there was a lot of back and forth and debate with our medical director. Is now the time? Do they need something else first? And we decided to give them a shot, even though it was questionable. And I was in a meeting room one day about 2 weeks later, and I just glanced out the window and I saw that same patient that could not talk, could not roll in bed, that I wondered how they would recover. I saw him walking out here on our sidewalk
Wow.
with a therapist, and
It's impressive.
it was still, can't talk about it, chill bumps. It was really impressive, and he made an amazing recovery, and it was, you know, just off the charts. And it made me think, what if we didn't give him that shot at this intense, because it's tough, right?
Oh, yeah.
It's an intense rehab program.
Yes.
So, you know, was that the best thing for him? I think 100%. We did the right thing. And it doesn't always, you know, work exactly like that. Sometimes it takes months and years
Yes.
for recoveries, and even a lifetime of those tweaks and tune-ups
Right.
and things. So he stands out in my mind when I think about a major brain injury recovery.
That's a good one.
It was great.
So that is wonderful. I'm very glad to hear that. So if you don't mind, we'll go look at the gym.
Okay, well, I gotta give you some props first, because you're also one of our success stories, Jared.
I appreciate that.
For sure. This piece of equipment here is a light gate. Did you use it while you were here?
Oh, yes.
You did?
It was the first thing I used.
Oh, good. So you know that they strap you in kind of like you're gonna do a bungee jump
Oh,
or
yes.
something, and you know, kind of hook you up and take that weight off so you can bounce yourself and get that feeling of walking.
Very good.
And with a therapist too. Yeah. Was it
Yeah.
scary?
Yes, I could. When I first used this, I could go like 10 feet, and that was all I could do.
Yeah.
So it was just rough.
And now here you are with
Yes.
nothing. I thought this would be scary to be hooked up when you
Yes.
hadn't been up on your legs.
It
And
was.
then you're standing there all on your own.
This is the outpatient area in there, right?
Yes.
Is there anyone in there?
They're actually on lunch. We can go in and look
Can
around.
peek in there?
Yeah. So they have a new piece of equipment in here called a myocycle.
Motorcycle.
Yes, it's kind of like a bicycle, only it has some electrodes that they hook up to different nerves to stimulate. And actually other people could tell us a lot more about it. But it stimulates some of those nerves and muscle groups to be able to move them and get that motion and exercise. Did you ever use
You see all this?
the finisher when you were here?
Nope.
This black piece of equipment down here?
Nope.
So that piece is, they can use it for that, you can stand on it, you can do leg things on it, and it can raise and you can like reach and do different planes.
Thing.
Yeah. And slide some things around in different
Finisher.
motions. The finisher. Yeah, I like that.
I like that too.
This is how we keep up with who's gonna be in what type of therapy. So they
Okay.
make sure everybody gets at least 3 hours every day. And, you know, they have a professional with them one-on-one, a therapist, and that's how they work their magic to make sure everybody is getting what they need
Very nice.
all day.
I
And the
never
plan
saw
for
that.
tomorrow. Yeah, it's really pretty fantastic. When they talk about how they do that, it's above me. We have speech therapy rooms here down the side. So, you know, when they're practicing memory, cognition, task, and of course speech things. Make sure you see that.
Oh.
They're able to close the door and just decrease those distractions. And,
Very cool.
yeah, lines on the
Very
floors,
nice.
showing people how far they've gone and staying on task and that kind of stuff. All the therapists do their documentation in here. The warm water therapy pool, and it has a lift over on one side, so if people aren't able to do the steps to walk into the pool, they just sit in the chair. It has an electric arm, turns around, lowers them into the water where the therapist is.
Oh, nice.
And there's a lot of things when you take some of that weight off from the buoyancy that people can do in the water. that can help them transition to be able to do that on land if they can't bear weight and that kind of stuff on their feet, legs, sometimes back and spinal cord. And the warm water's therapeutic to loosen things up a little.
Yeah, I couldn't use this when I was here because I had a pickle on my arm, so I couldn't get that wet, but this would have been very helpful.
Yes, and even as an older brain injury or post, it may be something that, maybe in the future, get in there and do something if you needed something extra done, some more work on something.
Perfect.
Yeah. So we like to think that these success stories motivate others that are able to read, oh, hey, this is like me when I came in, and this is the area where they may wait for the elevator, and they can hopefully be motivated by, what somebody else went through and feel like they're not alone.
Yeah.
Good.
Yeah.
Get him and Tyler. Yeah.
Who's that guy? Right there.